City Hospital is a private hospital offering general and specialist medical and surgical care. Doctors David and Esther are the proprietors of this hospital. In view of the COVID-19 outbreak, David and Esther have resolved to observe strict infection prevention and control measures during care of all patients in their hospital. The hospital is busy, and some patients are waiting to see their doctors in the outpatient department and wards. The nurses and other healthcare workers are wearing surgical gloves and face masks while carrying out their routine duties. A patient in the outpatient waiting area is coughing. This patient should have been offered a face mask or asked to cover his cough by coughing into the inside of his flexed elbow or into a disposable tissue. Esther is running the outpatient clinic. While waiting to see her first patient, she is following up on her social media messages on her mobile phone. Her first case is suspected to have an infectious disease, presenting as fever, vomiting and malaise. Esther is not sure if the patient could be a case of COVID-19. She decided to examine the patient wearing surgical gloves and a face mask. It was time to write her clinical notes. Unknown to her, the gloves were already contaminated during examination of the patient. She wrote her notes wearing her gloves, inadvertently contaminating the working area, including the desk, pen, and notepad. The next patient was on routine follow-up for osteoarthritis. Esther has removed her face mask and placed it on her desk. She explained the knee X-ray findings to her patient without changing her gloves. She was not aware that the face mask was already contaminated, and that she has also contaminated the X-ray film. While discussing with the patient, her phone rang. She answered the call without removing her gloves, thereby contaminating her mobile phone. Her next patient was a child with sore throat. She examined the throat of the child with a spatula while putting on a face mask but using the same pair of gloves. After examining the child, she kept her face mask on her desk for later use and disposed her gloves in a closed waste bin without performing hand hygiene. Esther is unaware that because she failed to practice hand hygiene after glove removal, she has inadvertently contaminated her hands. Without performing hand hygiene, she used her contaminated hands to auscultate the lungs of a young man who is a known case of valvular heart disease. The stethoscope and the chest wall of the patient are now contaminated. Dr. David and his team are to review patients admitted in the wards. The nurse on duty is taking vital signs and giving medications. Without regard to injection safety, the nurse has dropped the uncapped needle and syringe on the bedside table when a puncture-resistant box is available next to the patient's bed. Dr. Esther has referred the patient suspected to have an infectious disease for admission in one of the private wards. The patient zone, including the bedside table, bed sheet, drip stand, and bed rails are already contaminated by body fluids from this patient. Dr. David and his residents, including Drs. Nwosu and Amina, have decided to review this patient before visiting the general ward. The patient has developed respiratory symptoms, so all the doctors chose to wear surgical masks. David and Nwosu wore a surgical and cloth mask respectively, adequately covering their noses and mouths. However, Dr. Amina wore a surgical mask covering only her mouth but leaving her nostrils opened. While David examined the patient, Nwosu was holding the drip stand with his gloved right hand, unaware that the drip stand was already contaminated. Suddenly, the patient started coughing, releasing droplets to the environment. These droplets dispersed a short distance, some dropping to the floor and others landing on the masks worn by the healthcare workers. Unfortunately, since Dr. Amina was not wearing her masks properly, some droplets had access to her nostrils. Dr. Nwosu's cloth mask was also not sufficient to protect him as droplets easily penetrated through the mask. It was time to see patients in the general ward. The first patient was admitted with features of severe hypertension. Dr. David has now removed his gloves and face mask. He examined the patient without performing hand hygiene. Dr. Nwosu is still wearing the same pair of contaminated gloves. He is holding the patient's bedside table, oblivious that he has now contaminated the table. Dr. Ogoina is writing the clinical notes on behalf of the team, but she has pulled down her face masks under her jaw. A hand sanitizer was by the bedside, but none of the healthcare workers used it. The ward round is over. The hospital doorknobs and walls have been contaminated by the hands and gloves of healthcare workers. Dr. Ogoina dragged her mask from the front and pulled it off. Doctors David and Nwosu have decided to keep their masks in their pockets for later use. They are unaware that their masks were already contaminated and should be disposed in a close waste bin. Nwosu is carelessly removing his hand gloves, contaminating his hands in the process. David held the hands of one of his patients exchanging pleasantries, and since he is yet to perform hand hygiene, he has contaminated the hands of this patient. The receptionist has removed her face mask and placed it on her table. The face mask was already contaminated, and the working area of the receptionist has become inadvertently contaminated. Work is over. Dr. David and Esther are returning home after the day's work. Unfortunately, both doctors are returning home contaminated. For Esther, her hands, skirt, stethoscope, and pen were now contaminated. For David, his hands, pockets, and face masks were contaminated. David and Esther left the hospital believing they have practiced strict infection prevention and control. However, inappropriate use of gloves and face masks, as well as lack of practice of hand hygiene, has led to self-contamination and hospital environmental contamination, increasing the risk of healthcare-associated infection, including COVID-19.